Hey everybody, Dr. Patel here. Happy Friday. Hope you're all doing well. Sorry about the delay today, and thank you for joining me on this week's Facebook Live. Last week we started our sessions on the neck, and last week we went over some basic neck anatomy. This week, I wanted to start to get into what are the possible causes of neck pain. Now, the interesting thing is there are a lot of possible causes, a lot of different things that could be causing pain in the neck. And I'm going to list off what a lot of those options potentially could be. And over the next few weeks, I'm going to go through the anatomy and the physiology, the action, the mechanics of how some of those things can be painful. But really today is to outline what are all the different possible pain generators that we have. And I'll delve a little into some of those things, as well as what are the potential treatments that I typically recommend for patients with neck pain. Now, if you have any particular thoughts, questions, concerns, if there's any topics that you want me to discuss, please feel free to comment. You can send me a private message or DM if you have specific questions about your condition, or you can always email my staff at info@fxregencenter.com. If you want to learn more about the different types of things that we do, or if you want to see previous episodes of our Facebook Live, ranging in topics from knee pain to low back pain issues, then you can feel free to visit our website, fxregencenter.com. So, without further ado, what are all the different things that could be causing neck pain? First of all, if you're like me, or if you work at a desk, or if you really live at all, and this picture in front of you might seem pretty familiar, right? I don't know about you, but after a long day, I find myself sitting here and rubbing my neck often. There's not a week that goes by that I don't feel myself feeling a little bit stiff in my neck. And I think that neck pain is something that a lot of folks deal with in one way, shape, or form. Quite frankly, it's something that I think a lot of folks... Whoa. Sorry, you still with me? Yeah, all right. Quite frankly, I think it's something that a lot of folks actually ignore substantially. And that's because it's something that seems so normal, right? When was the first time that you remember experiencing neck pain? I know the first time that I felt neck pain was probably in high school, when I was sitting there studying for long hours, or I don't know what I was doing. Maybe I was doodling or drawing or God knows what. But it was during that time that I remember feeling some tightness in my neck, and then we've periodically have had things going on in the neck for years, right? And maybe it's just me, or maybe it's most people though, that we end up ignoring the pain quite a bit. And what ends up happening is that we think that it's a normal thing because of the way we're sitting, the way we're doing whatever we're doing, and we brush it off like something that's going to go away on its own. And a lot of times it does. So, well, what is that pain though? Why does that occur? And when is it something that we need to be a little bit more in tune with? When is it something that we shouldn't ignore? When is it a check engine light going off in your car that we may need to get checked out sooner than later? So I'm going to go through, last week we went through some of the anatomy, and I'm going to refresh some of the anatomy here, and then go through what are the different things that could cause pain. So first and foremost, just going through some of the anatomy here again. This is just a picture of the back of the spine, right? And what you can see, if you can see my cursor here, this is the back of the skull. This is actually your jaw over here. And these are the spine vertebral bodies. These things that you see right here are the spinous processes, or the nubbins that we feel on the back of our neck. These areas here, which is where one bone meets another bone on either side, are your facet joints. Down here is when we get into the upper back, actually, and these are where the upper back vertebral bodies meet your clavicle and your ribs. And then what you see kind of yellow peeking out in between these areas is the spinal cord, and what we don't really see in this image is where the nerves are exiting on either side. So to kind of highlight that from a different angle here, let's see. I'll pull up just an x-ray of the neck like we did last time. And I don't know where my neck x-ray went. Copy image and paste. Okay, so this is an image of a side view x-ray of the neck, and when we're looking here, these are the vertebral bodies, the bones. This is where the discs are in between. These are those facet joints that we saw from the back view, and these are those spinous processes, again, the nubbins that we feel when we press the back of our neck. There's several different things that can cause pain in all of these areas, ranging from the discs, the joints, the ligaments, the muscles. All of these various things can cause pain. But I kind of want to outline and be a little bit more organized and explain, all right, what are all of those things, and what is it that can cause pain in those areas. So I'm just going to make a list of the different possible things that can cause pain. And the way that I'd like to organize myself is ultimately, I'm going to break it down into two components. Either we're talking about the musculoskeletal system, right? Or we're going to be talking about the nervous system. Okay? And there's two different kind of categories there that we talk about. And just broadly speaking, in the musculoskeletal system, we have the bones, right? We have where the bones connect with each other, which are what are called the joints, right? We have the discs, or the shock absorbers, between the vertebral bodies of the spine. We have the ligaments, that are the duct tape that connects bone to bone together. And then we have your muscles, which are the muscles that move the various different bones in different positions. Now, the one thing that people oftentimes neglect, but I think is a very common component of your pain, whether it's a direct pain generator or a structural thing, is actually this thing called the fascia. Now, I didn't talk about the fascia when we did the anatomy lesson last time, but the fascia is essentially the soft tissue, connective tissue web that connects everything in our body. Fascia can be found surrounding bones, surrounding joints, surrounding muscle, surrounding ligaments, surrounding nerves, but also in sheets underneath the skin, and in sheets connecting various different muscles and joints and bones together. And it really is this interconnected web throughout our body that up until recently was thought to be this minor thing, but we now recognize as, quite frankly, the largest organ system in our body and something that connects everything together. The fascia is something that can get restricted and can cause pain in various different ways, and I'll explain that in a minute. Now, on the nerve side, this is a smaller list overall, but there's a couple of things to consider. There's number one is the brain. Number two is the spinal cord. And together, those two things comprise the central nervous system. And then we have your nerve roots. And then you have your peripheral nerves. And these are comprised of the peripheral nervous system. Now, to just briefly talk about that, the brain is what sits inside your noggin, inside your skull. That is then connected via the brainstem into the spinal cord, and the spinal cord goes through the cervical spine, the thoracic spine, and ends at the top portion of the lumbar spine. That spinal cord and brain combination is what's called the central nervous system. Off of the spinal cord come nerve roots that then exit out of the neck and go down the arms in different distributions. And after they exit out of the necks, they form a web, which is called the brachial plexus, where there's interconnections of various nerves. And then we're left with individual peripheral nerves that go down the arm in different directions. So an example of a peripheral nerve that you may have heard of is the nerve that goes through the carpal tunnel, which is called the median nerve. Okay? That's just one nerve, one of the major nerves that go down the arms. The other nerves include the ulnar nerve and the radial nerve on the back of your arm. And there's multiple other nerves that are large and small throughout the arm, and those are called the peripheral nerves. And each of those nerves actually come from branches of different nerve roots. And there's different nerve roots that go all the way down. There are 7 vertebral bodies, and from each, above and below each of those segments, so a total of 8 nerve roots exit out of the neck and go into different directions. So, speaking strictly about the nervous system, there are potential pain generators that could be found from really all of those sources. Typically, when we're talking about neck pain, pain can come from irritation to the nerves in the neck. However, typically, pain from irritation to the nerves in the neck or pinching of the nerves in the neck, typically that causes stuff to radiate in different directions. So if you have pain in the neck that's also going down your arm in different directions, then that might be a result of a nerve irritation or injury. When we talk about different nerves, really, when we talk about those nerve type injuries, we're talking about the nerve roots. Peripheral nerves are actually beyond the neck region. So injury to the peripheral nerves typically does not cause neck pain. Okay? Injury to the spinal cord could potentially cause neck pain for sure, but injury to the spinal cord can also cause a lot of other symptoms, including pain, numbness, tingling, or even weakness down the arms. Depending on the area or location of the spinal cord injury, that could also cause symptoms to go down into the legs. An injury to the spinal cord is of much more significant concern. And if that is something that is progressive, or if there's actual damage that's occurring to the spinal cord, that may actually be a circumstance where surgery is required in an emergent fashion, because if we have significant injury to the spinal cord, that's the type of thing that can lead to paralysis. Similarly, irritation or injury to the brain can also potentially cause neck issues, but those type of injuries or issues can also cause a lot of other symptoms. Typical brain injuries that we think about are things like a stroke, where there's an infarct or decrease in blood, whether it's due to a bleed or a blood clot to a part of the brain. Signs of stroke that we all should be aware of, and we need to be wary of if we have these signs or symptoms, include things like sudden loss of vision on one side, or a facial droop on one side, or weakness in one arm, or weakness in one leg, or certainly weakness on one side of the body, but also more subtle things like sudden confusion, or sudden difficulty speaking, garbled speech, difficulty swallowing. All of these things could be potential signs of damage or injury to the brain. The other common brain injury that we think about are things like concussions. Concussions, in the most common sense, is what we think about when we have a head injury and we get knocked out, right? If you actually fall, or you hit your head, or you get in a car accident, or you do something, you're a football player and you're helmet-to-helmet contact, which is why it is banned, that injury to the head can cause a sudden shock to the brain, and that's considered a concussion. A severe head injury can cause things like a bleed or direct damage to the brain, but oftentimes concussion is considered a less severe or a mild traumatic brain injury, and this also does not necessarily have to occur with impact. This is the type of injury that can occur with just a sudden shaking of the head or a whiplash type condition. Now, it is very common when somebody gets a concussion, the focus ends up being on the brain because we end up having these kind of cognitive effects, right? We can have memory loss, we can have confusion, we can have light sensitivity, or things along those lines. So the focus is obviously on the brain because the brain is the most important, but a lot of the injuries that can cause a concussion can also cause whiplash injuries to the neck itself. And that is a segue into the musculoskeletal system. I am going to come back to the nervous system shortly, but now segueing into the musculoskeletal system, there are a lot of different things that can be injured in the neck. Whiplash, for example, that I just mentioned, that sudden motion in the neck can cause a pull or an injury or a trauma to things such as the ligaments inside the neck. Okay? The ligaments are the duct tape that connects bone to bone, or as I've described in previous lectures, the ligaments are the thick rubber bands that surround broccoli in the grocery store, right? So they're thick, they're supportive, but there's a little bit of a stretch to them. Thanks again, Susan. Now those rubber bands, if we suddenly stretch those rubber bands in a whiplash type injury, those rubber bands or ligaments can get pulled, which is called a sprain. They can get little micro tears inside them, or they can have more traumatic injury where there's a more significant tear that takes place, and those type of things can cause pain in the neck. We also have ligament type capsules that surround the facet joints, and that's oftentimes an area that's injured in a whiplash type injury. So segueing from that to the facet joints, the facet joints are the joints on either side of the neck where one bone meets another bone and where the motion takes place. As we're getting older and we get some friction in the joints, over time we start to get degeneration or osteoarthritis. That in itself does not necessarily equal pain, but a joint that has arthritis, it's easier for that joint to get irritated or inflamed, and that's certainly something that can be painful. So that's talking about joints. There are other joints other than the facet joints in the neck. There's also what are called the uncovertebral joints, which surround the disc on either side, and these can also develop arthritis as well. But ultimately the joints are where one bone meets another bone. So when talking about the joints, we can't neglect the bones themselves. Can the bones become pain generators? Well, yeah, absolutely. If we have a trauma and there's a fracture or a break that occurs in the bone, then that can certainly be something that causes pain. Other things that can cause pain in the bone, from the bone itself, particularly from the vertebral body, is when we have something called a compression fracture, which can occur for various reasons, including old age and having osteoporosis or having lower bone mineral density. This can occur traumatically as well, The most common example when you think about a compression fracture in somebody that does not have osteoporosis or weakened bones due to age or various other conditions could be, if you're diving into a shallow pool and you hit the top of your head, that can actually cause compression fractures, not only in the neck, but also in the thoracic or upper back, as well as even the low back at times. The final thing that can cause pain in the bones, and this is something that is not degenerative and not traumatic, is actually cancer. So deeper pain in the bone itself can be caused by primary or metastatic bone cancer that ends up invading into the bone, and that could be a significantly, considerable pain generator. And when we talk about the bones, the biggest bones in the spine, in the cervical spine, are the vertebral bodies that stack on top of each other, right? Those vertebral bodies, this is the front of the body, back of the body, right? These vertebral bodies are the major bones, and in between those are the discs, right? And we've talked about the discs in previous lectures, so I won't go ad nauseum, but the discs are like those water balloons, and as I've mentioned before, it's multiple layers of rubber and then the jelly in the inside, which is a thick, nice, cushiony shock absorber in the spine. Now, as we get older, that shock absorber starts to degenerate or dehydrate. That disc degeneration or degenerative disc disease does not necessarily equal pain. But that degenerated disc can start to get painful. And one of the theories behind that is that there's actually a balance of different bacteria that live inside the discs. There's actually a microbiome inside the disc, similar to the microbiome that's in your gut, or similar to the flora or microbiome that lies on the skin. And that's a balance of different bacteria that are inside the disc. And as there's disc degeneration and various things that are occurring in that area, that balance of bacteria can actually change, and you can end up with an infection inside the disc that can start eating away at the edges of the disc, which are what are called modic changes. There's different types of modic changes that take place, but some are associated with inflammation or irritation. So that's a way that a degenerative disc can actually become painful. In the absence of a disc degeneration and this potential inflammation or potential inflammatory condition in the disc itself, the rubber, I mentioned multiple layers of rubber and the jelly on the inside, right? The rubber of the rubber balloon can actually get an injury. That rubber can get a tear in it, and that could be substantially painful. So that could be a part of what's called the annulus or annular tears. That can occur with whiplash injuries. That could occur with lifting something funky and suddenly feeling a pop snap in the neck. Various things can cause that. And when the disc gets injured, the disc gets torn, then that can, number one, cause a significant amount of pain, but it can also cause other issues. When that pain occurs, the muscles throughout the neck, God bless them, those muscles can tighten up to try to take pressure off of the disc. They're reacting, they're trying to help you out, but those muscles tightening up and freaking out can become a part of the pain condition as well. So the muscles can then be a part of the issue. Why can the muscles also get irritated? Well, I mentioned ligaments getting injured from a whiplash injury. Again, if those ligaments are injured, and therefore the duct tape that connects bone to bone is not as supportive as it should be, well, then the muscles are like, all right, if the ligaments aren't keeping the neck upright, then the muscles have to tighten up in order to try to provide support. So then the muscles can get aggravated in that regard as well. And then finally, direct muscle traumas can occur. Injuries to the tendons where muscle attaches to bone, or injuries to the muscle themselves can occur and cause pain. And when we talk about the muscles, we can't leave out the fascia. Because when the muscles are tightening in various different ways, or when they're not firing correctly, the fascia or the soft tissue that surrounds these muscles starts getting hung up, starts getting stuck in different manners. This can also occur in the absence of trauma or in the absence of degeneration with things like our posture. So hear me out. This posture looks very common for a lot of people, and I might be exaggerating a little bit, or I might be, pretty accurate, but it's very common for us to be looking down at our cell phones, looking down at our laptops, driving our car, watching TV, and that posture, that rounding forward, our head moving forward, our shoulders rounding forward, this is an issue. And I know this personally because I have really crappy posture, and my wife yells at me every night at the dinner table when I'm eating like a Neanderthal, right? But this is something that plagues us, especially all of us that are using the computers all the time, right? Because that ends up being the position that we're in. Well, what does that position do? That causes us to stretch our ligaments. All these ligament structures that are trying to keep the neck together get stretched over time. So take one of those thick rubber bands, and you're slowly stretching that rubber band over time. You're not suddenly pulling it and ripping the rubber band. You're slowly stretching that rubber band over time. That rubber band's going to get looser. And as that looseness occurs, again, those muscles want to tighten up in order to try to provide stability. In order to try to keep your head on straight, those muscles tighten up. And the fascia gets pulled when we're sitting in these positions. So all these stretchings occur for all these fascial structures, and that then becomes a pain generator as well. Ultimately, it's this vicious cycle, because as you end up rounding forward, the ligaments get looser, the muscles get tighter, the fascia gets hung up in various ways, and then we end up putting more friction into the joints, which ends up causing arthritis to be worse, right? The ligaments are looser, so then the bone starts to bulk up in order to try to provide stability for the joints, and that's when we get bone spurs, right? We end up putting more pressure into the disc, and the disc degenerates more, and then the disc, since it's a water balloon and we put pressure on the balloon, it bulges outwards, and what does that do? That irritates the nerve roots. Right? So you can see how all of these things end up being interconnected. And ultimately, there's a lot of stuff that can cause pain. And traditionally, when we talk about treating these conditions, we try to find what is the pain generator. What is that one thing that's going to be causing the pain? If we can cure that one thing, all of your symptoms will go away. And rarely that is the case. Rarely we have, an injury that caused a single level disc bulge that caused a nerve irritation, and that's your pain generator. Even in that circumstance, you can see there's a few different moving parts, but more often than not, we have layers of different things that are going on, or what I like to say that there's the animals in the zoo. There's multiple animals in the zoo. And with traditional pain management, we try to do things like epidural steroid injections or trigger point injections for the muscles or facet joint injections. And we try to treat these specific targeted things. But if we try to tame the lion in the zoo, which is your main pain generator, but we don't try to tame the monkeys and the hyenas and the whatever else that's making noise, well, those animals are still out of control. The lion's going to get annoyed and start roaring again, right? So when I see patients that have neck pain, I think it's absolutely important to figure out what is the main pain generator or what are the main pain generators, but also to see what are all the structural elements of what's going on and how do we treat this as comprehensively as possible, or what's called treating the whole functional spinal unit. So ultimately, what we end up doing is things like physical therapy to strengthen the muscles and get the body moving correctly, right? Nutrition to get your body healing from the inside, and targeted injection treatments to specifically hit not only the pain generators and calm down the inflammation around nerves or in a joint, but also to strengthen the various different soft tissue structures, strengthen the things in order to take pressure off of the areas, and in order to provide longer lasting relief. But as far as treatment is concerned, I will get into that on another date. Today, really wanted to get through some of these pain generators, all the different things that can be causing pain in your neck. I hope this was helpful for you. There's a lot of different things, as you noticed on this list. Everything from the bones, the joints, the discs, the ligaments, the muscles, the fascia, the nerves, the spinal cord, and the brain can all be things that can cause pain in the neck. It's important to have the appropriate diagnosis before treating. It's important to see a healthcare practitioner, a physician, or a physical therapist, or a chiropractor that not only says, all right, this is the thing that's going on, but also takes a step back to look at the whole picture. And only then can we not only get short-term relief, but get long-term relief as well. Again, I hope this was helpful for you guys. If there's anything specific that you want me to address, again, comment, DM, please email us at info@fxregencenter.com. I'm going to answer some of these questions that I have in the comments right quick, and then I'll see you next week. So Kathy said, I definitely think mine falls under nerves, muscles too, past concussions, whiplash, car accidents, a lot of different things, and you know, it's oftentimes not one thing, it's oftentimes a multitude. Kathy asked, what about when massaging the back of the neck to relieve pressure in the head? Is that weak ligaments or something else? Massaging, when you massage, that's typically relaxing the muscles, and that can, the muscles can cause pain not only in the neck, but muscles can cause pain radiating into the head. There are a lot of different things that can cause pain going into the head, and I'll go through that on a different date. But if massaging relieves some of the pain into the head, well, some of that head pain could be coming from the muscles themselves. But if that does not last, well, then those muscles are tightening up for an underlying reason. Whether that underlying reason is the ligaments, the joints, the nerves, that's a different topic. That needs to be really determined in order to get the best overall outcomes. So when pushing on spots on both sides of the lower head, beginning of the neck, I can feel in the teeth. Is that nerves? So yeah, there's a bunch of different nerves that sit in the base of the neck. Everything from what are called the greater occipital nerves. The typical pattern of pain for that is in this direction. There's a whole plexus, the upper cervical plexus of nerves, can cause symptoms to go in various different places into the jaw, into the face as well. So those are definitely things that could be a piece of the puzzle. Oh, and Kathy said, hi, Dr. Patel. Hi, Kathy. And Michael said, can neck muscles themselves become fibrotic or pull to entrap nerves, i.e. capitis, suboccipital muscle pain, or scalenes? Great questions. So we got to be careful about words like fibrotic. We got to be careful about words like scar tissue. There are a lot of healthcare practitioners, including physicians, chiropractors, physical therapists, body workers, manual therapists, etc., that use words like scar tissue to describe the feel, the nature of what these muscles and or fascia feel like to the hands. Now, is that really fibrosis or is that really scar tissue? That's debatable. It may or may not be. There are some circumstances when we have specific trauma that actual true scar tissue can occur, but sometimes what we're perceiving as fibrosis or perceiving as scar tissue is actually the fascia, that because the fascia is not gliding properly, it can get sticky, it can get brittle, it can get stuck in areas, and it could feel as if there's scar tissue underneath, but it may or may not actually be scar tissue. So it may or may not be fibrosis, so to speak. The muscle can become atrophied, which can be confused with fibrosis as well. So atrophy is when the muscle actually dies back or it gets inactive and starts getting replaced by fat. Muscle that gets replaced by fat has a distinctive different feel compared to nice healthy muscle that's firing appropriately. That feel of a muscle that has atrophy definitely has a fibrotic feel to it. That type of muscle is more stiff. and that can certainly cause irritation to other structures around it. A muscle can get tight and also compress on nerves that are traveling through them. So the scalenes in the front of the neck, the middle and anterior scalenes, the brachial plexus, or the web of nerves that come from the middle to lower cervical spine, do go through those anterior and middle scalene muscles. And if those muscles are tight, then that can cause compression of those nerves, and that can cause symptoms to go down the arm. But the question is, why are those muscles tight in the first place? Are they tightening up because of posture and because of the way we're sitting? Are they tightening up in reaction to something else? Or are they tightening up because the nerve signal to those muscles is not sending the right signal? Suboccipital muscles in the back of the head, there's a ton of muscles in the back of the head that are providing stability to the skull, that are involved with intricate movements of the head. And these muscles do have various nerves traveling through them, such as the greater occipital nerve that I mentioned earlier. And those muscles, again, if they're tight, if they're angry, can cause compression to those nerves. But what's causing those muscles to tighten in the first place, right? So there's a lot of things that we can do to look at what are the potential pain generators. Is it the muscle? Is it the nerve? Is it the ligament? Is it the fascia? But we always have to take a step back and look at why, right? So that's all for today. I hope you guys found this helpful. Again, please visit us at fxregencenter.com. If you enjoyed this video, please share it, like it, share it with your enemies, share it with your friends. If anyone you know has neck pain, and everyone has neck pain, please share this so people can understand there are a lot of different things that are potentially causing the pain in your neck. Have a happy rest of your Friday, folks, and have a great, great weekend. Stay cool. It's a hot one out there, and I will see you all next week.